Hey everybody, this is Dr. Joanne Gordon, naturopathic physician. I practice at Natural Health Works in Oregon City. Today I want to talk to you about what do hormones have to do with joint pain. So first of all, I just wanted to let you know that my doctor journey started out with focusing on helping people with muscle and joint pain. You might not know this, but before medical school, I was an orthopedic and sports physical therapist. So you can see that working in the area of joint pain has always been a passion of mine, and it is still today a very strong passion of mine. However, I've come to realize that sometimes pain can be hard to get rid of if your hormones are in the dumps. So I began entering into the land of hormones when I started to notice that my patients will feel a lot better and get better quicker when they were on hormone therapy. So let's just explore hormones a little bit and how they affect your joints and pain levels. If you have low thyroid can make you feel sluggish, affect your metabolism and cellular turnover. So you can understand how if your thyroid is not working well, your healing might not go as easily as we'd like to. So sometimes if your skin is cut and it takes forever to heal, it may do better if your thyroid is optimized and the cells can heal quicker. So if your thyroid is not working optimally, your healing can be a bit slower. What about testosterone? So testosterone helps support bones and muscle strength, and turns out that chronic pain is associated with low testosterone levels. So the lower your testosterone, the higher your pain level. So having optimal testosterone can help manage pain and improve your overall sense of well-being. Estrogen. So I often see a lot of women with joint pain, and a lot of them have low estrogen. It turns out that more than half of menopausal women have joint pain. So I wonder if hormones have anything to do with that. So estrogen can help prevent chronic inflammation, and it can also help protect cartilage in the joints. So it makes sense to me to optimize estrogen to help reduce joint pain and inflammation. So I really don't like to discuss hormones anymore without talking a little bit about insulin. I've been spending the last few years researching insulin and helping people lower their insulin. It's made a huge difference. So high insulin, when your insulin levels are high, it can be associated with lots of chronic conditions, including inflammation and joint pain. So when insulin is above optimal range, it starts to affect many systems in the body, including the joints, but also heart disease. It affects the arteries, it affects the nerves. Many people are aware that diabetes and insulin go together. With diabetes, you have both high insulin and high blood sugar. However, before your blood sugar gets high and you're not a diabetic yet, your insulin levels can be high. And so when your insulin level is high, your pancreas is working its butt off to keep your blood sugar in normal ranges. What happens is the pancreas gets a little bit tired over time, and the cells cannot keep storing all the glucose that the insulin's putting into them. And so the cells get tired and they stop responding. That's when diabetes sets in, and the cells just aren't able to absorb any more glucose, and the blood sugar starts to rise. When the blood sugar starts to go up, diabetes sets in. It's no longer to keep the blood sugar under control, and that's where there's no more room to store the excess sugar. The answer here is really not more insulin. It's about taking the sugar and carbs out of your diet. And so when we lower insulin, that helps lower inflammation, it helps lower weight, it helps lower your heart disease, lower cholesterol. It lowers blood pressure, better sleep, better mood, and just a better life. So as you can see, there's many hormones that can influence your joint pain, and I just really want to help you optimize your health by optimizing your hormone balance. If you have any questions, give me a call, 503-722-7776. I can also be reached at info@drjoannegordon.com. Thanks so much for listening, and hope you have a great day.